Let us now learn about corticospinal tracts. We know that movement is a fundamental characteristic property of all the animals, but even the seemingly simple activities require complex background decisions. Like consider reaching for an object on the table. Not only we need to make decisions about the path trajectory in the space, which in turn decides about the muscles to activate and in what sequence, but also about the speed, force and power with which to pick up the object. Movements are classified as reflex movements, which are controlled at the level of spinal cord or brainstem, stereotyped repetitive movements, which are controlled at the level of spinal cord, brainstem and cerebellum, and then the goal-directed movements, which require inputs from cerebral cortex, basal ganglia and cerebellum. Let us check out the neural structures involved in movement control. Motor cortex along with the rest of the cortex sends in the descending fibers, which include corticospinal, corticonuclear and corticopontine fibers. Corticopontine fibers relay in the pontine nuclei. Corticonuclear fibers relay in all the cranial nerve nuclei. The corticospinal fibers reach the spinal cord, where they relay on the interneurons or directly on the motor neurons. The motor neurons then send information to muscles as well as the structures around the joints. These descending fibers from the cortex will send collaterals to superior colliculus, which influences the activity of spinal cord through tectospinal tract, to red nucleus, which sends information to spinal cord through rubrospinal tract, to vestibular nucleus, which sends information to spinal cord through vestibulospinal tract, and to reticular formation, which sends information to spinal cord through reticulospinal tract. In addition to these structures which are involved in movement control, there are two other structures which also influence movements. They are the cerebellum and basal nuclei. Cerebellum receives input from vestibular nucleus, spinal cord and pontine nuclei, and basal nucleus receives information from the cerebral cortex predominantly. All these three structures, that is spinal cord, cerebellum and basal nuclei, then send their information to thalamus, which relays this information to the cortex, which decides about the movement. The descending tracts to the spinal cord are divided as lateral system of tracts and medial system of tracts. The lateral system of tracts will supply the distal limb muscles which are involved in fine motor control. So the lateral system includes corticospinal tract and the rubrospinal tract. The medial system, on the contrary, usually supplies the proximal limb muscles or the axial muscles, which are involved in rhythmic and postural control, and they include the tectospinal tract, vestibulospinal tract and the reticulospinal tract. The corticonuclear fibers and the corticospinal fibers together are called as pyramidal tracts, and the rest of the tracts are called as extrapyramidal tracts, although this terminology is no more used now. The descending tracts to the spinal cord either help in controlling the movements, posture and muscle tone, or they modulate the spinal reflexes, or they modulate the sensory information transmission in the afferent pathways, or they control the autonomic neurons which are located in the spinal cord. Let us consider only the corticospinal tract here. Other descending tracts will be considered elsewhere. So corticospinal tract begins from the neurons in the cerebral cortex. It ends on the contralateral interneurons or motor neurons in the spinal cord, and throughout its tract it is having somatotopic projection. Let us see the entire pathway of the corticospinal tract briefly here. The corticospinal tract begins from the motor cortex and other cortical areas. Axons of these neurons located here are projected to the spinal cord as corticospinal tract. First, they descend through the white matter of cerebrum in a radiating fashion, contributing partly to the corona radiata. Then they form a compact bundle in the internal capsule. Then these fibers descend through the brainstem, passing through the crus cerebri in the midbrain, basilar part in the pons, and pyramids in the medulla. In the lower medulla, just above the spinomedullary junction, majority of these fibers cross at the pyramidal decussation to form the lateral corticospinal tract. The uncrossed fibers descend as ventral corticospinal tract. The cross fibers of the lateral corticospinal tract fibers terminate at the appropriate levels by synapsing with the interneurons or motor neurons of the same side. The uncrossed fibers in the ventral corticospinal tract either cross in the spinal cord to synapse with the contralateral neurons, or a few may terminate on the ipsilateral side. The corticospinal tract influences both alpha and gamma motor neurons, and they facilitate the flexors and inhibit the extensors. So let's first start with the cortex. The cortical areas that contribute to corticospinal tract include the primary motor cortex, which contributes to 30% of the fibers, premotor area or area number 6, which contributes to another 30% of the fibers, and then the primary somatosensory area, area 5 in the parietal cortex, and supplementary motor area and cingulate cortex on the medial surface. Now these last few areas will contribute to the remaining 40% of the fibers. In the motor cortex, the corticospinal fibers arise from upper 2/3 of the primary motor area, as shown by this asterisk marking the area. The upper area will be contributing to corticospinal fibers, because this area represents upper limbs, trunk, and lower limbs in the motor homunculus. Now, this is the horizontal section of the brain. Identify the head of caudate nucleus, thalamus, and lentiform nucleus. Now, the parts of the internal capsule include the anterior limb, which is located between the caudate nucleus and lentiform nucleus, posterior limb between the thalamus and the lentiform nucleus. Genu is tucked between the anterior and posterior limbs. Retrolentiform part, that is part behind the lentiform nucleus, carries the optic radiation fibers to the occipital lobe. The corticospinal tract fibers are located in the anterior 2/3 of the posterior limb of the internal capsule, having a somatotopy of cervical fibers or the upper limb fibers arranged anteriorly, and the sacral or the lower limb fibers arranged posteriorly. Now coming to the midbrain. Midbrain is made up of crus cerebri, substantia nigra, tegmentum, and tectum anteroposteriorly. The crus cerebri, substantia nigra, and tegmentum form the cerebral peduncles. The corticospinal tracts are located in the middle 2/3 of the crus cerebri, with an arrangement of cervical fibers medially and sacral fibers laterally. In the upper pons, the corticospinal tract fibers are located in the basilar part. The darker areas seen in the fresh cut section include both the pontine nuclei as well as the longitudinally running fibers of corticospinal and corticonuclear fibers. The transversely running pontocerebellar fibers not only separate the corticospinal fibers into multiple bundles, but they also push them away from the surface, unlike what we see in midbrain and medulla. In the lower pons, the picture is similar to that in the upper pons. In the open medulla, we see two swellings on either side of the midline, the medial longitudinal pyramids and the lateral oval olives containing inferior olivary nuclear complex. The corticospinal tract fibers are located in the pyramids here. Again, they reach the surface, and it is these pyramids that give the name pyramidal tract to the corticospinal fibers. And within these pyramids, the cervical fibers are medial and sacral fibers are lateral. So each pyramid contains about 1 million fibers. 70% are myelinated. 90% of the fibers are about 1 to 4 microns in diameter. 8 to 9% have 5 to 10 micron diameter, whereas about 2 to 3% fibers have 11 to 22 micron diameter, and these are the axons of giant pyramidal cells of beds which are located in the primary motor area. Now coming to the lower medulla, the level of this section is shown in the right hand side of the picture here. Here, about 75 to 90% of the fibers in the pyramids cross to the opposite side to form the lateral corticospinal tract. About 10 to 15% of uncrossed fibers continue as the ventral corticospinal tract. Remaining uncrossed fibers, that may amount to even as much as 10% of the fibers, they accompany the lateral corticospinal tract. Now this crossing of the fibers in the pyramid is what we call as pyramidal decussation. In the spinal cord, the lateral corticospinal tract is seen in the lateral funiculus, where it is located immediately anterior to the dorsal horn and medial to the posterior spinocerebellar tract. Anterior or the ventral spinocerebellar tract is located in the ventral funiculus along the anterior median fissure. There is a thin sulcomarginal fasciculus which separates the ventral tract from the surface. While the lateral tract descends all the way to the S4 or S5 segment, the anterior tract usually disappears at the mid-thoracic level. Most fibers of the lateral tract terminate on the interneurons in laminae 5 to 8. Some fibers from the corticospinal tract may terminate directly on the motor neurons, which are located in lamina 9. Now, such terminations are most commonly seen in the cord enlargements, where they terminate on the neurons in dorsolateral or retrodorsolateral neuronal groups, and these supply the muscles of the hand. As the lateral corticospinal tract descends, its size diminishes progressively as the innermost fibers terminate on the ipsilateral neurons at each segmental level. So about 55% of the fibers terminate at the cervical segments, 20% in the thoracic levels, and only the last 25% will be seen in the lumbosacral segments where they terminate. In the lower lumbar or sacral levels, the lateral corticospinal tract actually reaches the surface because the posterior spinocerebellar tract will be absent here. Coming to the ventral tract fibers, they cross to the opposite side in the anterior white commissure to synapse with the neurons located on the contralateral side, or a few fibers may end on the ipsilateral side. Coming to the somatotopy, in the spinal cord, the cervical fibers are the innermost and the sacral fibers are the outermost in case of lateral corticospinal tract. So the corticospinal fibers facilitate flexors and inhibit the extensors. They modulate the spinal reflexes, and fibers which are coming from the sensory cortex are also involved in supraspinal modulation of impulse transmission in the ascending tracts. Their functions differ depending upon on which cell they synapse with. Those fibers that end on the alpha motor neurons, they bring about fractionation movements by selectively activating a few neurons, which results in either precision movements or what we call as highly skilled movements in the distal limb muscles, like what we see in buttoning of a shirt or tying a shoelace or even performing a robotic surgery. Those fibers which end on the Renshaw cells, they have many actions, but one of them is the co-contraction of both prime movers and antagonists, which will help in stabilizing or fixing a joint. Those that end on excitatory interneurons in lamina 7, they recruit motor neurons of both axial and proximal limb muscles. Those that end on 1A inhibitory interneurons in lamina 6 and 7, they relax the antagonist muscles before the prime movers begin to act. And fibers ending on presynaptic inhibitory neurons can either suppress stretch reflex when needed, like in case of sprinting, the stretch reflex of the quadriceps has to be suppressed when the foot strikes to prevent its rupture. Or these fibers which end on the presynaptic inhibitory neurons can suppress the sensory transmission through the spinothalamic tract during the voluntary movements. Their endings in the gracile and cuneate nuclei, they have much more subtle modulations. That is, they enhance sensory transmission during slow exploratory movements, whereas reduce the sensory transmission in the rapid movements. So what happens in the lesion of a corticospinal tract? It is a classical upper motor neuron lesion. Pure lesion of CST will bring about flaccid paralysis, loss of all independent hand and finger movements, and Babinski sign will be positive. Whereas in case of stroke, which involves other tracts also, there will be associated hyperreactive deep tendon reflexes, absent superficial reflexes, hypertonia, clonus, and positive Babinski sign. We see an initial flaccid paralysis followed by spastic contralateral hemiplegia. This spasticity and hyperreflexia are usually explained on the basis of hyperreactive stretch reflexes due to interruption in the inhibitory corticospinal tract inputs. This may also be helped by probably increasing deposition of collagen fibers within the muscle, or even shifting some of the extrafusion muscle fibers from the fast twitch type to slow twitch type over time. So corticospinal tract forms a major pathway which connects cerebral cortex to the spinal cord. Most important function, of course, being the motor control of fine fractionated movements. It, however, also can modulate sensory inputs, or it can modulate even the reflexes. Thank you very much. Hope you enjoyed this video. Please visit this site.